What is SSSC? Superior Suspensory Shoulder Complex. Gange in 1975 first coined the term the floating shoulder. The floating shoulder is, by definition, it is ipsilateral glenoid surgical neck fracture along with midshaft of the clavicle fracture. Gauss in 1993 introduced the concept of the superior suspensory shoulder complex. It is the suspensory complex through which the appendicular skeleton of the upper arm suspended from the axial skeleton, that is chest. What is superior suspensory shoulder complex? It is a bone and soft tissue ring that is secured to the trunk by support by superior and inferior bony struts from which upper extremity is suspended. What is SSSC? SSSC is the bone and the soft tissue ring secured to the trunk by superior and inferior bony struts from which upper extremity is suspended. The superior strut is formed by the clavicle. Inferior strut is formed by the lateral most portion of the scapular body and medial portion of the glenoid process, and the ring is formed by the lateral part of the clavicle, coracoacromial ligaments, acromion process, and the glenoid process, and the coracoid process, and coracoclavicular ligaments. And there is a secondary support is formed by the coracoacromial ligaments. The complex can be subdivided into the 3 units. That is, first unit is the clavicular, acromioclavicular joint and acromial strut. And the second unit is the 3 process. That is the acromion process, coracoid process, and the glenoid process and scapular body junction. Third unit is formed by the clavicular and the coracoclavicular ligament and coracoid process. This is called the C4 linkage. What is the biomechanics of this SSSC? It is each component acts as an individual function and point of the attachment for the musculotendinous and ligamentous structures and allows limited movement through the coracoclavicular and acroclavicular articulations and maintain normal stable relationship between the upper extremity and the axial skeleton, that is between the arm and the chest. This traumatic disruption of one component common, but it is minor. If the following injuries are the unstable injuries. What are the unstable injuries? There is a double disruption of the soft tissue ring, and there is a disruption of the one portion of the ring with fracture of the one of the struts, and third one is the fracture of the both the struts. And unstable injuries are the type in lateral part of the clavicle fracture is classified by the modified needs. According to modified needs, type 2 and 5 distal clavicle fractures are the unstable injuries. According to the Rockwood AC fracture classification, type 3 and beyond type 3 are the unstable injuries. And if there is a fracture of the glenoid neck and the disruption of the fracture of the glenoid neck along with an disruption of the superior suspensory shoulder complex, that is AC joint, acromion fracture, clavicular fracture. Problems. What are the problems if the superior suspensory shoulder complex is injured? First, acute problem and chronic problems. Acute problems with healing. There is a delayed union, malunion, and non-union. And chronic problems, long-term pain due to subacromial impingement, and there is a weakness and discomfort due to the muscle fatigue. There is a drooping of the shoulder contour is not maintained, and because of the subacromial impingement, there is a decrease in space subacromial, and there is a neurovascular compression occurs of the brachial plexus pass beneath the coracoid process. So brachial plexus compression of the brachial plexus can be occur, and there is a degenerative joint disease. There is what are the investigations we order? We order the true AP view of the shoulder. That is the gray shave view, and lateral view, scapular Y view, and the trauma axillary view known as the valpio axillary view, and CT scan. If summary is the first, there is a superior suspensory shoulder complex. Superior suspensory shoulder complex disruption. There is a distal fragment. Distal fragment is displaced inferiorly Anteromedially, by the altered muscle forces and the weight of the extremity, there is a significant if there is a significant displacement at the fracture site, there is a chances of the malunion is most common. Because of the malunion, there is a drooping of the shoulder, brachial plexus pressure, relationship between the glenohumeral joint with the acromion alter, decreased ROM. There is a weakness in the abduction subacromial pain more common. There is a loss of the normal liver arm of the rotator cuff muscles. If the traumatic disruption of the superior suspensory shoulder complex is seen, be careful to look for the second disruption. The second disruption is present or not. If double disruption is present, decide whether there is a displacement, high possibility of the adverse healing and functional consequence. If so, surgical management of the either one or both the disruption can be suggested. Thank you.